A very good morning to one and all. Am I audible?
Yes, ma'am. Good morning.
Very good morning. Today we will going to see the next disease, central nervous system disease. Today we will going to see the schizophrenia. Is it visible my screen?
Yes, ma'am.
Okay. Before going to the schizophrenia, we have to understand what do you mean by psychosis, isn't it? So first of all, we will see this one. What do you mean by psychosis? Actually, psych means what? Mind, isn't it? Psych means what? Mind, which we can't define, isn't it? That is an ill-defined term. Psych, our mind. We can't define our mind, isn't it? Psych is defined by various stimuli which induces behavioral changes in the individual. Due to that stimuli, which induces the behavioral changes in the individual, that is termed as psychosis. A synchronized stimulation is there sometimes, so that's why we can't think properly, that we called as a psychosis. Psych means what? Mind, and it is defined when actually it is ill-defined time. Vague terminology is there, isn't it? So the Swami Vivekananda told us what the thoughts of the Swami Vivekananda, how we can control our mind. If we will control our mind by the meditation, the spiritual knowledge should be necessary. The spiritual knowledge should be necessary that can destroy our other miseries, worries, tension. If we will not control, then these diseases are there, isn't it? So psyche is ill-defined by various stimuli, which induces the behavioral changes due to these stimuli, due to these thoughts, isn't it? The individual behavioral changes in the, and this terminology is called as a psychosis. Now see here. Psych means mind. If it is affected by the cerebral deformity, any accident or any deformities is there, any damage is there, then what happens? It is a major psychosis. It is a major psychosis. And this is called as a schizophrenia. If mind, if psych is affected due to the cerebral deformities, any type of the disease, any type of the damage, any type of the accident, if it will get damaged, then what? It is called as a major psychosis. That major psychosis is termed as schizophrenia, called as schizophrenia. And now see here, if it is affected due to anxiety, minor things, due to anxiety, due to depression. Last lecture we seen depression, isn't it? So if it is this mind, our mind, if it is affected due to the anxiety, depression, that is called as a minor psychosis. That is called as a minor psychosis, and that is defined as a mania, and that is defined as a mania. Okay, so are you clear all this one? Psych, if it is mind, if it is affected by the cerebral deformity, it causes the major psychosis, that is defined as a schizophrenia. Today we will going to see the schizophrenia. Okay, if it is affected due to the anxiety, due to the depression, that is called as a minor psychosis. And minor psychosis, it is defined as a mania. Now see here, what do you mean by what? Mania, it is means what? It is a hyperactivity, uncontrollable thought and speech associated with the violent behavior. Violent behavior means what? Aggressiveness, too much. Some individuals are too much aggressive, isn't it? Hyperactivity, they will do such a activity that is we called as a hyperactivity that can't be controlled. Uncontrollable thoughts, unnecessary, they will talk like anything, too much loud shout, they will shout, they will do aggressiveness, hyperactivity, isn't it? That is called as a mania. Usually we say that this person is historical, or sometimes we call it as a maniac person, isn't it? And depression, yesterday we seen this one, depression means what? Sadness, guilty feeling, isn't it? Always in the depressed, low activity. Here exactly opposite, that is the mania, and exactly opposite of this mania, it is a depression. Too much sadness, guilty feeling, physical and mental slowing, all the activities will go slow. Self-destructive nature, they will damage their self only. Okay, they will cut, they will do, they wish to do suicide, everything that is under the depression. And neurosis, actually neurosis is a less serious illness in which the patient is able to understand the reality. The individual know what is going on surrounding, understand the reality. Depending on the severity of its feature, it can be categorized as anxiety. We can say that one, that person is under anxiety, that everything, isn't it? Is it visible my screen?
Yes, ma'am.
Yes, ma'am.
Okay. Anxiety, categorized as anxiety. Okay. We always used to say OCD problem is there. OCD means what? Obsessive compulsive disorder. In which what happen? The person, in which the people have recurring unwanted thoughts, ideas, and sensation. Always in the hallucination, feeling of well-beingness in their world only, isn't it? They will think like anything. Their ideas are different, their sensations are different, unwanted thoughts are coming in that individual. That is called as a obsessive compulsive disorder. OCD problem is there. Always used to say normally we can say that one. OCD means what? Obsessive compulsive disorder. What happens here? The individual always used to think the unwanted thoughts, ideas, sensation. Okay, the individual is in the hallucination, delusions, isn't it? So like that, the reactive depression, stress, and hysterical. Always used to say hysterical. Hysterical means what? We say that always, that person is hysterical or something. In our language it is there, hysterical means what? Hysterical means what? Hmm? We can't define that one. No, the person is, the behavioral of that patient is something, something, means what we can say here in Marathi, hysterical. आपण म्हणतो ना, काय म्हणतो बरं? Yeah. Doing something, another things. Anyone? Hysteric.
Weird.
Hmm?
Weird.
Beer?
Weird things.
Some another thing they used to do, that one under the depression or under stress or under something, the ideas, that unwanted thoughts, unwanted things they will do, something other than the society. They will behave like that, something other than the society. So we will not accept in the normally in that, in our society. So that is the hysterical. Okay. See, this is all about the mania, depression, neurosis, isn't it? Now we will see today's, that is the schizophrenia. Schizophrenia, that is a mental disorder. It is characterized by abnormal social behavior. Abnormal social behavior, that is the hysterical. Now, abnormal social behavior and failure to understand what is real. What is real? Failure to understand here what is the reality. Abnormal behavior is there in the schizophrenia. You always used to see here in the picture films, isn't it? Schizophrenic patients, we can't control that individual, so that's why we have to give some of the IV, so that the patient will, the individual will calm down, calm and quiet for that, isn't it? So here we will see today the schizophrenia. This is the mental disorder characterized by abnormal social behavior and failure to understand what is real, what is reality. Okay, patients of the schizophrenia have additional mental health problem like anxiety disorder and major depressive illness. Actually, yesterday only I told you, anxiety and too much anxiety and too much depression, if we will not treat this patient, that time only that will aggressive, that will extend to schizophrenia, that will extend to schizophrenia. Okay, so that's why they have the problem like anxiety disorder and unnecessary tension, worry, isn't it? Unnecessary major depressive, this is the major depressive illness. Okay, they have attend to do the suicide, isn't it? That is the major depressive illness. They will harm their self and they will harm to the others also, because they are not knowing the reality, they are not knowing the reality, they can't understand what is the reality, because this is the mental disorder. Okay, symptoms typically develop gradually. Gradual development, not a sudden time. Okay, not a sudden. If the cerebral disorder ability is there, deformities is there, sometimes what happens, sudden is also there. But symptoms, whatever the symptoms are there, that is gradually developed, began the adulthood and last for a long time. Okay, adulthood sometimes, and if the patient, if the individual have the harm, any accident or anything, that time in the younger age also they can face in the this schizophrenia. Okay, now see the types of schizophrenia: catatonic, paranoid, disorganized, residual, and schizoaffective undifferentiated schizophrenia. We will see one by one. What do you mean by catatonic type? Catatonic type means what? In this case, the person is extremely withdrawn. Extremely withdrawn means what? From where they will get withdrawn from themselves? From the society, from the relatives, from the our friend circle, isn't it? So it is extremely withdrawn, negative and isolated. They feel loneliness. They are isolated from the family. They are isolated from the friend circle, isn't it? Has marked psychomotor disturbances. They will, they keep themselves alone only. They like to live alone only. So this is the catatonic type, means person is extremely withdrawn, negative sensation, isolation, and has marked psychomotor disturbances. Too much thought, too much depression, here it is there. Psychomotor disturbances are there, unwanted thoughts. Okay, paranoid type means what? These persons are very suspicious of the others. They will suspect to the others. Here, what they will feel? Hallucination, delusions, isn't it? This is the common here. Hallucination and delusions. Frequently delusions, false beliefs. I am this, I am this, like that only. In the feeling of well-beingness only, always. They are dreamy in nature. Are a prominent and common part of the illness. These symptoms are common for this type of paranoid type, means always suspicious to the others. Okay, they will suspect to the others. Now this one, disorganized type. Disorganized type means what? These persons are often confused and have jumbled speech, always in the confusion and jumbled in the speech, will not talk, jumbling. Sometimes they used to say other, and sometimes they will change the subject, isn't it? Jumbling in the speech. Their mood and emotions that is not appropriate in the to the situation. Hallucinations are not usually present, but what mood and emotions here affect? Not appropriate to the situation, not according to the situation. The subject, beyond the subject, they will talk, isn't it? Sometimes we used to say, our what is our subject and what you are going to talk, isn't it? Sometimes we used to say like that. That is a jumbling is there, confusion is there, too much confusion is there. We are talking some other things and they are thinking the other things. They are talking the other things. That is confused state totally. And residual type means what? The persons are not currently suffering from the delusions, hallucinations, or disorganized speech and behavior, but lack of motivation and interest in day-to-day living. This is all about the depression, residual type. This is depression. Okay, not having any type of the mood, any type of the motivation, and do not have any type of the interest in daily life. Okay, these are away from this delusion. These are not having these symptoms: hallucination, delusions, disorganized speech and behavior. No, they will keep mum. They are not having any type of the motivation, any type of the interest in the daily life. Okay, this is the residual type. And next one, schizoaffective disorder. Schizoaffective disorder means what? These people have symptoms of schizophrenia as well as mood disorder such as major depression. Here, schizophrenia and major depression related to one another. Related to one another. Bipolar mania, both sides. Bipolar mania and mixed mania. Mania, hysterical, mania, what we told, hyperactivity is there, isn't it? In the mania, what we studied in the mania, hyperactivity, uncontrollable thought. It the patient, the individual will become what? Violent. The individual will become violent. So both types. Depression is also there, and the mania, mixed mania, bipolar mania, both types are there, isn't it? Means this mania and depression are actually opposite to each other. In the mania, the individual is hyperactivity. In the depression, the patient will become quiet, isolated, negative thinker, isn't it? But here bipolar, sometimes mix, or we can call it as a mixed mania. Okay. Undifferentiated schizophrenia means what? This subtype is diagnosed when the person's symptoms do not clearly represent one of the other types. Sometimes we feel like that, not like that schizophrenia, not like that mania, not like that depression, this residual type or other types. That is undifferentiated schizophrenia. We cannot differentiate what type, under what type the individual is. So we can call as a undifferentiated schizophrenia, not a single symptom. Vague symptoms are there, so we can't differentiate. That is called as a undifferentiated schizophrenia. Now see the etiology. Etiology, what are the causes are there? Causes are there, actually too much causes are there. Actually, what for what, we can't understand fully sometimes, due to confidently we can't say, isn't it? This is the we, so that's why the causes are not fully known, but however we can define. That is, it may be due to the genetic, it is more important, isn't it? Schizophrenia has a strong hereditary component. Our parents, if they are hysterical or maniac, then that genes will come from the parents to the offsprings. Okay, that is the strong hereditary component. Schizophrenia, actually individuals with first degree relative, parent or sibling who has schizophrenia, if the parents having the schizophrenia, there are chances to 10% chances are there to coming to that their offspring. Okay, 10% chances are there. And if the schizophrenia is from the outside general population, there is 1% chances are there. Okay, 1% chances are there. So that's why schizophrenia, it is we called as a hereditary component. Okay. Now next one, that is the environmental. Environmental, these two scientists suggest that the inherited genes make a person vulnerable, more prone to schizophrenia, more prone to the more vulnerable, prone to the schizophrenia, and then the environmental factors act on this vulnerability to trigger the disorder. Already the patient is having genetic problem, that is the schizophrenia. If the and other environmental factors will also trigger, also exaggerate, also increases the disorder. Which type of the environmental? If family relationship is not there, if they are not getting the love, if other problems are there, tension, worry, other symptoms are there, these are the environmental factors. Already the patient is individual is having these type of the genetic problems are there, isn't it? And again the environment also, surrounding environment is also like that only. So that's why what happened, that schizophrenia, that symptoms will aggregate, means what, aggressiveness will be there, increase that symptoms, and more prone to that schizophrenia. Okay, this is the due to that environment. High levels of the stress, see I told, high levels of stress are believed to trigger the schizophrenia. Trigger the schizophrenia, increases the schizophrenia by increasing the body's production of hormone cortisol. Yesterday we seen that ki hormones, neurotransmitters are responsible for our mood, for our behavioral changes, that is the mood changes. Okay, cortisol, it is the bad hormone. Cortisol, it is the bad hormone which causes the mood changing. Okay, so always you should not take any type of the stress. Do not give the stress or do not take the stress in our life. Okay, high levels of stress will causes all type of the diseases, that is it will increases, triggers the schizophrenia. Stress inducing environmental factors that may be involved. Which type of the environmental? Then this exposure to the viral infection. Nowadays you are seeing, due to this viral infection, everywhere the stress is there, isn't it? They will become due to that viral infection, isn't it? That will exaggerate, that will trigger the schizophrenia. Low oxygen level during the birth, see, low oxygen levels during the birth, it causes what, prolonged labor or premature birth, and due to that the neonatal, that due to that the this by birth only that individual is having the problem, due to what, due to low oxygen level. So that's how much important is their oxygen. Are you understood now? Why the low levels of the oxygen? Because in the HAP we studied that if a small single second also, if we will not get our brain cell oxygen, then they will damage permanently. Millions are their cells in our brain, but if a few seconds or fraction of the second, if we will not get the oxygen, then what happens, the cells will damage permanently. So that's why during the birth, if we will not get the oxygen, oxygen levels are hampered or it is low, then what happens, permanently the cell damages. Which cell damages? Brain cell damages, that is the cerebro, that is called as a CNS disorder, that deformities, cerebrospinal or this what we called as cerebral deformities will develop during the birth only, isn't it? Due to these low oxygen levels. Due to low oxygen levels, permanent damaging, permanent death of the brain cells are there. So that's why exposure to the virus during infancy. During birth only, if the virus will attack, there may be problem to cerebral deformities, isn't it? The damaging or a disease state. Okay. Early prenatal loss or separation means what here? divorce, isn't it? In the childhood only, if the mother and father will get, the parents will separate. If if their parents will lose, then there may be a strong affected, their strongly their brain will be affected, isn't it? So that's why due to this they will become schizophrenic. I- isn't it? Physical and sexual abuse in the childhood. So these are the environmental factors. So many environmental factors are there. You can write your own. Here are the few of the examples are there. Okay, that you have to write your own also. Okay, abnormal brain structure. Abnormal brain structure, their chemistry, abnormalities in the brain structure may also play a role in the schizophrenia. By birth only, sometimes the abnormal chemistry is there, brain chemistry is there. Okay, enlarged brain ventricles are seen in some schizophrenics. If we scanned that brain, that time we understood the ventricles are enlarged and indicating a deficient volume in the brain tissue. Okay, due to that deformities causes the schizophrenia. There is also evidence of abnormally low activity in the frontal lobe. So many areas are there, isn't it, in our brain? You studied in the 12th. Which areas are there? Memory area, speech area, hearing area, reasoning area, isn't it? So, if abnormalities in the low activity of the frontal lobe, the area of the brain responsible for planning, reasoning, and decision making, they will change, isn't it? So, due to that abnormality, there may be prone to the disease that is the schizophrenia. Now, see the neurotransmitters. This is the very important how the hormones are affecting, like that the neurotransmitters are also affecting to our this schizophrenia. These are the chemicals that carry the message between the brain cells. Cell to cell communication. For this cell to cell communication, neurotransmitters are essential. Okay. There is a connection between neurotransmitters and schizophrenia because drugs that alter these levels of the neurotransmitters in the brain are known to relieve some of the symptoms of the schizophrenia. Some of the neurotransmitters, if we will give externally, if we will release that one, that will alter the mood, that will alter the symptoms of the schizophrenia. So that's why by giving, by this proof, we are having this proof, so that's why we can tell, we can say that there is a relation in between the neurotransmitter and schizophrenia, because some of the neurotransmitters are good. If we will give that one, if we will release into the brain that neurotransmitter, that changes the symptoms of the schizophrenia, isn't it? So that's why we used to say there is a connection between this schizophrenia and neurotransmitters. Now see the drug abuse. Drugs do not directly cause the schizophrenia directly, but if we will misuse that drug, then there is a risk for developing the schizophrenia or similar type of the illness, that is the hysteric mania, depression, other things. Okay, this is about the drug abuse. Okay, now next one, stress. Everywhere the stress will come. The main psychological triggers of the schizophrenia are stressful life events such as what? Losing of the job, home, divorce, losing of the parents in the childhood only, or the end of the relationship, physical, sexual abuse, emotional or racial abuse. So many things are there under which will come under the stress, which will come under the stress. These kinds of the experience thought stressful do not cause schizophrenia but can trigger the development. Directly they will not develop the schizophrenia, but that will increases gradually the signs and symptoms, and that will become, if we will not treat, if we will not control these, then it will develop the schizophrenia. Are you getting? So don't give and don't take the stress. Be a stressless life. Okay. These are all about the environmental factors. Are you understood this one? Etiology, genetic is there, 10% problems are there, chances are there from parents to the offsprings. Okay. Environmental factors are there. You can write your own viral low levels of the oxygen exposure to the virus during infancy, early parental loss or separation, divorce, physical sexual abuse in the childhood only, abnormal brain structure due to abnormal brain structure by birth only, that is neurotransmitters are there, drug abuse is there, stress is there, isn't it? Now see the symptoms. Signs and symptoms of the schizophrenia will vary depending upon the individual. Individual to individual, it will vary. So see the signs and symptoms classified into four categories, that is the positive symptoms, negative symptoms. We will see one by one. Positive symptoms. It is also known as a psychotic symptoms. It is also known as a psychotic symptoms. Feeling or behaviors that are usually not present here. Which one? Feelings or behaviors, that is hallucination, delusions, thought disorder, movement disorder. Actually, here in this one, it is not present. But here in the negative symptoms, capabilities, those are lost from the person's personality. Due to that one, it causes the negative symptom. These symptoms, these are social withdrawal. Here, all these will symptoms related to the depression. Social withdrawal, lack of interest, lack of emotional expression, lack of feelings, lack of energy, speech difficulties, abnormalities. Here, all the symptoms, these are related to the depression. Okay. But here in this will be not, we can't, the hallucinations, delusions, thought disorders, movement disorders are not present. Okay, all these feelings. Now see the cognitive symptoms. Cognitive means what? Memory problems. All the, it is related to our memory. Okay, thinking ability. These are the symptoms related to the person's thought processes. Thought processes, poor concentration, poor memory, disorganized thinking, slow thinking, difficulty in understanding, difficulty in expressing the thought, means especially all due to the thinking problem. That is we called as a terminology cognition. Cognition, जागे आहे का आपण असं म्हणतो ना, काय आहे का, शुद्धीवर आहे का असं म्हणतो ना आपण मराठीत, दॅट इज कोग्निशन प्रॉब्लेम. ओके. Emotional, these are the symptoms with the person's feelings, heart feeling. Okay, usually negative symptoms such as loss of motivation, social withdrawal, demoralization, suicide, all these will come. Emotional, here all the factors will come under the emotions. Okay, these are the four factors, that is the positive symptoms, negative symptoms, cognition and emotional symptoms. Are you understand? Are you
Yes, ma'am.
getting all this one? Okay, now see the pathogenesis, how the gradually develops this disease. Genetic predisposition, if it any it is there, or otherwise environmental, social or psychological factors. This one causes what? Neurodevelopmental abnormalities and target the features. Due to this, neurodevelopment abnormalities will be developed in the cerebrum or brain. Cerebral deformities will be there due to this or maybe due to this. Okay, both factors will affect. And what happens here? Due to this neurodevelopment abnormalities, brain dysfunction, improper balance of the chemicals. Balance of the chemicals means what? Hormonal and neurotransmitter. Okay, and causes the schizophrenia, and this causes the schizophrenia. What happened? We see the etiology, that is the maybe genetic or the environmental. Okay, social psychological factors. Okay, this causes what? Neurodevelopmental abnormalities and target features. Due to this, the brain is not working properly. The brain dysfunction is there. Improper balance of the chemicals. Chemicals means what? The release of the hormones, neurotransmitters. These are not in a balanced state. So that's why it causes schizophrenia. This is all about, in short, I told you the pathogenesis. Otherwise, vast therapy is there. So only schematic representation, simple language, this much is sufficient for your level. Okay. How we can diagnose this patient? How we can diagnose? Actually, we have to take the medical history, the individual's history by talkative nature, by talking, by asking the series of the questions, we can understood the patient is having this and this type of the disease. Okay. Diagnosis of schizophrenia is made based on full psychiatric evaluation, medical history, physical examination, and lab test. Lab test we will test in this one: blood, CBC, hormonal secretions, neurotransmitters, everything we will get here. Psychiatric examination by asking the series of the question about the loved ones, symptoms, psychiatric history, family history, mental health problems, everything here we will ask to that patient. Or if that individual is not able to talk, then we will ask to their family what is the history is there, that individual or otherwise in the family. Okay. Medical history now. Personal and family health history will help to identify the cause of the schizophrenia. By taking history only, we can understood what type of the disease is there. Okay. Physical examination, complete physical examination helps to take the medical issues and could be causing a problem. Complete physical examination we will take here. Okay. And the other things, blood, urine, in the blood CBC, other blood tests are there for seeing the chemicals, neurotransmitter, presence of all these one. We can understand. Okay. Causes of the symptoms we can diagnose by the laboratory test. Imagining in this one, scanning, all types of scanning we will do here. Brain imagining studies such as MRI, CT scan. Okay, everything we will check. So that's why we can understand, we can take out the various photos, and due to that one, where the abnormalities are there, we can understood, and according to that one, the doctor can diagnose the patient is suffering from this and this. Okay, this is all about the diagnosis. Psychiatric evaluation, medical history, physical examination, laboratory examination, laboratory test, and imaging studies, all types of the scanning. Due to that scanning purpose, we can understand the brain abnormalities by taking the various photos. Treatment. Psychotropic drugs, antipsychotics we will give here. Okay. So that's why here we will change the neurotransmitters, the hormones. So that's we are saying that this schizophrenia and neurotransmitters are related to one another. They are having connections in between, because antipsychotics, neuroleptics, major tranquilizers, what the drugs will do here? These are the major tranquilizers. Tranquilizers means what here? These drug, when we will give to that patient, they will calm down the patient. If they are too much aggressive, then what we have to do? Give the tranquilizers. Okay, give the tranquilizers. So that's why they will cool, they will calm down. Okay. Example, chlorpromazine. It is a drug of choice for this schizophrenia. Okay. For hyperactivity patient, chlorpromazine is effective, too much effective. Aggressive patient, we have to give the chlorpromazine. Okay. Anti-anxiety drugs. Anti-anxiety drug, if the patient is having anxiety, we will give the anti-anxiety drugs. Means what? Here also these anxiolytic drug, these are the sedatives and minor tranquilizers. Sedatives means what? These drug will stop the thinking power of that individual. So that's why automatically the individual will become calm and thoughtless. So that's why no any thought, no any tension, no any stress, no any worry, no any anxiety. So that's why anxiolytic drugs are sedatives, minor tranquilizers are used for anxiety and phobic state. In the phobia, fear, tension, worry, isn't it? Some of the individuals are having different phobia are there. In among you, some of the students are having exam phobia, isn't it? If the exam is near, they will become ill, isn't it? That we call it as a exam phobia. Some are having the higher side phobia, that is the, if they will go to the uh, means what, height phobia is also there. Too much height is there, they will feel phobia, they will feel fear, isn't it? So many phobias are there. Water phobia is there, that other phobias are there, too many. Antidepressants used for the minor as well as major depressive illness, for the depressions. Phobic state also we can give. OCD, obsessive or compulsion behavior, in that also we can give the antidepressants. And certain anxiety disorder we can give the antidepressants. Yesterday we have seen the tricyclic antidepressants, isn't it? 5-hydroxytryptamine, serotonin. These are the mood elevator. These neurotransmitters are there, isn't it? So that's why we have to give like this as an antidepressant. Antimaniac used to control the maniac patients, used to control the mania. Okay, these are the antimanic agents. These are all about the pharmacological agents. These are all about the drugs.
Cállate, oye, cállate. ¿Ah? Ay, mucho de.
Samklesh Kamkar. For time pass, don't come here. Otherwise, no use of this lecture, isn't it? You are starting the videos and doing any comments. I'm not here taking your presenting. If you wish, if you have interest, then come. Unnecessary, don't join the class. Now, next one we will see the rehabilitation. Rehabilitation, that is the, means what? The patients are depression, under tension, under this surroundings are not proper. Then what we have to do, these patients change the surroundings. So this we called as a rehabilitation. So many rehabilitation centers are there. Okay, rehabilitation emphasizes what happens, social and vocational trainings to help the people with schizophrenia function better in their communities. Here, what we have to do, here the other side we have to shift the patient. There they will take care of that individual. Doctors are there, nurses are there, the surroundings is good, mood elevators are there. Okay, surrounding should be good, greenery is there, other things, music, and all the therapies they will do to increase the patient's mood, to increase the individual's mood. So that's why we have to, so many rehabilitation centers are there for these patients, for these individuals. So that's why this is the another treatment, that is the rehabilitation. If the family members are not properly taking care of that individual, then shift there that patient. Okay, this helps the patient to hold the jobs, remember the important details and problem solving skills. There the doctors, nurses and every, all the these members under this working under this rehabilitation center, they will manage these type of the individuals. So that's why gradually these patients, these individuals will will cure from that one, will come from that schizophrenia. Okay, and cognitive behavior therapy means what? It works on the thinking. Cognition means only the memory, thinking and behavior. Okay, cognitive behavior therapy help to reduce the severity of the problems and reduce the risk of relapse. Again, it will not come. Okay, again, it will not hamper. So we have to give the cognitive behavior therapy. Family education, this is more important. Family education nowadays all are means I used to tell you only one kid are there, one kid is there for the family, isn't it? Father is also working, mother is also working, and that individual, the children are living alone and they feel their loneliness because the isolation families are there nowadays, isn't it? So the individual will feel loneliness. They can't know whom to talk, no, that one. So that's why family education is very important. Therapists educate the family members how to handle these type of the patients and how to solve their problems, because we will give too much tension to that, we will aggressive before only, isn't it? If they are not hearing our, then what the family members are doing, they will shout on them. But here it is a totally opposite. They should love to that individual, how to handle these patients. That is a proper training they will give here. This is called as a family education. How to handle that individual who is suffering from, who is having schizophrenia, who is under the depression. So don't shout them at all. How to handle these patients, these candidates, there they will educate the family. So this is called as a family education. So that's why we can solve this type of the problem. Self-help groups means what here? Professional therapists usually is not involved here. Okay, but the group members support and comfort each other. Other groups are there. In this one, in the society, they are not actually doctors professionally, isn't it? But psychologically they will help them. Okay, psychologists are there, isn't it? So other things, psychologists are there by educate the people how to handle, how to solve the problem, so they will not become any type of the depression or other tension, other worries. So these are the other groups. If we will give them to, if we will took them to these group of the groups, they will treat there only. So by asking questionnaires, and they will solve their only problem, because some of the individuals, they are not open to their family members. But if we will take them into these group, then they will open there. Okay, so that's why the problem will solve. If we know the reason, then we can solve the problem, isn't it? So that's why there are the different groups, self-help group that will help and that will support and comfort each other. Okay, these are all about the treatment. Now complications, which type of the complication? Due to depression, due to mania, due to hysterical, what they will do? They try to attempt the suicide, isn't it? Self-injury, anxiety disorder, depression, abuse of alcohol. Some of the individual in depression, they will take the drugs, they will abuse the alcohol, other they will abuse habitual of that other drugs, including this tobacco, isn't it? Legal and financial problems, homelessness, social isolation is there, health and medical problems are there, other so many factors are there, complications, isn't it? This is all about the schizophrenia. Okay, are you understood this one?
Yes, ma'am.
Yes,
We stop here only then.